what we are talking about today with the Ottawa County Department of Public Health. And Sarah, I'm going to throw the ball into your court. Go ahead.
And Marcia, it's a delight to see you via Zoom, and Gary, to see you via Zoom also. Marcia, again, just tell us, what is your role at the Ottawa County Department of Public Health?
Good morning, Sarah. I am the Deputy Health Officer here at the Health Department.
And, you know, the focus has been on COVID, but really, you know, your office is busy. What other services are you providing?
Yeah, so we did a lot before COVID, and we are trying to maintain our core public health services during the pandemic. So many of these are offered by appointment, and we work with clients to maximize their safety, but we continue to offer sexually transmitted disease testing, family planning, women's health exams, and vaccinations in our clinics, including travel vaccination. Our environmental health division is still inspecting food and water and septic systems and landfills and recycling centers. So we're doing all of that. We have home visiting services for mothers and babies and resources for those struggling with their health and access to health care and lots of other things. So all of those are a little bit scaled back, but we are trying to maintain those services because we all know that it's important to maintain our overall health, not just our COVID-related health.
Yeah, and you know, thank you, because I know you're working double duty, and we truly appreciate that the leadership that the Ottawa County Public Health is giving during this pandemic. So last week, Marcia, Michigan extended current COVID-19 restrictions for 1 month. Provide us an overview of what this means.
Well, basically, the restrictions that had been in place since March were just extended for another month, and there was no real change, except there was one addition. And it's been a little bit contentious, and it was based on the recommendation from the American Academy of Pediatrics. And they added that children ages 2 to 4 should also be wearing face masks when in public, and particularly asking that child care facilities and camps make a good faith effort with these youngest children, since we are seeing more COVID cases in young children and more serious cases in younger people.
So, you know, the question is, you know, Marcia, we got graduation right around the corner, you know, and people are thinking about those celebrations. They're, you know, thinking about parties. Give us some perspective on all of that.
Yeah, you know, everybody is thinking about that. And, you know, last year, all of those things, none of those things happened, and it was a tough year. And that is part of being healthy too. The healthy population is being able to celebrate together. So those things are starting up. People are they're making their best effort to work within the orders and apply all that we've learned over the last year plus to make that a safe event. So, you know, people who are vaccinated, though, really like that's our nugget of gold there. Anybody who's vaccinated can hang out with anybody else who's vaccinated without masks, without distancing, you know, without concern. But when we have these social events, then, you know, you're mixing lots of different groups of people, and many of them can't be vaccinated. If you're under 16, you have no chance of it right now. So we're still recommending masking when in public, distancing, all the things that we've been learning, the things that we know, and schools and churches and cities who are having festivals are all making those plans and working with the health department very carefully, and we're really grateful.
Yeah, we need people to be diligent at this point, right?
Yes, we just need to hang on. I know, like, school has been so hard this year for kids, and we're just kind of asking in the middle of another surge, that we just hold on till the end of the school year, and we're really, really hoping and advocating, if there's not another wrinkle that we haven't thought of yet, that it will be better come fall. But vaccine is really the way to get there.
You know, Marcia, also last week, the Food and Drug Administration and the Center for Disease Control and Prevention caused for a pause in the use of the Johnson & Johnson vaccine. You know, why was it done?
You know, the CDC and the FDA take vaccine safety very seriously. They always have for all vaccines, because you're giving vaccine, like I've said to you before, Sarah, to people who are healthy and well. And that falls under a much higher degree of scrutiny than medicine is treating someone who's sick or possibly dying, right? Mm-hmm. There are more safety steps being taken, even more with the COVID-19 vaccines, because they're authorized for emergency use. So 6 women experienced a rare form of blood clot 2 weeks after their vaccination. And so Johnson & Johnson, that was reported in the systems that are set up. So they worked. So that's the good
Yeah.
news. Like, we're monitoring safety. We detected this issue. It seems to be more than what we would expect to happen. It's a very rare blood clot. You shouldn't see very many of these. And so they paused it because it has to be safe. And they're investigating further until we know more.
So how did Ottawa County respond when you got that news?
First was, oh no, like, oh no, we had so many vaccine clinics set up for Johnson & Johnson. And because it's a single dose vaccine and it only needs refrigeration, not freezing, it's so much easier to send out to doctors' offices and to get to homeless shelters and use in migrant camps, and just great. So that was our first reaction. But immediately we contacted all healthcare providers with an alert to let them know that this was paused and to monitor patients for possible signs of these blood clots. And we tried wherever possible to substitute Pfizer or Moderna instead of Johnson & Johnson where we could for the clinics that we had.
So, some people out there are saying, I have the vaccine, the J&J. Should I be concerned?
I would never tell someone not to have any concern, but about 7 million people have received doses of Johnson & Johnson, and 6 people had this rare blood clot, and we haven't seen any additional ones since. But we're kind of asking people to monitor themselves for about 30 days after their last dose to look for those symptoms that might indicate something is off. And we're always encouraging everyone, use the reporting systems that are in place. If you have any side effect from the vaccine at any point, tell us and let us know. There are places, the Vaccine Adverse Event Reporting System, people can look that up, or VAERS, so that kind of fast. Google that and you'll find it.
Go ahead.
Let me just sort of reset things because we sort of stumbled into the beginning of this particular segment. This is Wellspring on 99.7 and 1450 WHTC. Sara Donkersloot is chatting with Marcia Mansaray, the deputy executive. Well, I don't want to give you too big of a title, Marcia, but she is one of the leaders with the Ottawa County Department of Public Health, and we might be able to have time to take a question at 395-1450. But for the most part, it's a lot to unpack, and I'm going to throw it back to you, Sara. Go right ahead.
The hard thing about this, Marcia, is some people are saying, "Oh, now I shouldn't get a vaccine," and that's not the message that we want to share. It's still very, very important for people to get vaccinated.
It is very important, and the vaccines are very, very safe. And you're always there. We can't eliminate risk from the world, right? But we have to look at what we're comparing here. We're comparing COVID-19 virus infection with the vaccine. And it's a very clear comparison. You're at much more risk if you get infected with COVID-19 of having long-term side effects or worse than with the vaccine. So I've received the vaccine. My family's received the vaccine. We're doing great. So many people. We've given so many, 200 million doses of vaccine in the United States. And so far, this is the only severe thing that we have noticed. People do have normal side effects, a headache, a sore arm, feeling tired for a few days, things like that, but they're temporary.
And we're seeing the effectiveness of the vaccine now with a surge, in terms of hospitalizations. Talk a little bit about that.
Yeah, so, Ottawa County is surging just like the rest of Michigan, but it is a little different. So we're seeing fewer deaths. That's the big victory to celebrate. Almost, I'm not sure if we've even had a death. I think maybe we've had one, maybe in a vaccinated person. I'm thinking not, but I'd have to look at that again. Fewer hospitalizations, although they are younger. And what we're seeing in case rates, the rate of cases who are getting COVID-19, it mirrors the level of vaccination. So our highest rates of COVID cases are in 16 and 19-year-olds and younger, and only 16 and up can get vaccination. And they have just about 5% of them are vaccinated. But when we look at our oldest ages, we have tiny little case rates and high levels of vaccination. And so it's a perfect illustration and great evidence to see where we could be down the road if we keep moving in this direction.
Let me step in for a second, Sara. I got a caller while you were answering that question, Marcia. Concerns about people who have been vaccinated. For the most part, they cannot contract the disease, but there are concerns about perhaps being a carrier of it. Is that a legitimate concern? In, where are we standing on those who have been vaccinated being perhaps carriers of the disease?
Well, that's something, Gary, that's a great question. And thank you, caller, for asking that. That is something that we talked a lot about at the beginning of the vaccinations, because we really had no idea. These were new and we hadn't had COVID. There's initial evidence that people, they might carry it, but they don't seem to be transmitting it if they are, and they don't seem to be affected by it themselves. So we will continue learning more, but the initial research is looking good.
So let's talk, we got a couple minutes left, Marcia. We could talk with you for a long time. We just really appreciate your expertise and insight. Let's talk about vaccinations. It's open to 16-year-olds now, right? And yes, the county is doing something very special and unique for people who are on teams. Talk about that.
Oh, yes, we have special clinics for teenagers and athletic teams. The vaccine, anyone is eligible now. We even have walk-in appointments available throughout the county at various providers. So it's really easy to get the vaccine. The supply is meeting the demand. So if you want it, you should be able to get it. But there are so many positives for getting it. If you're a student, you can graduate without worrying about quarantine if you get vaccinated right now. If you're on an athletic team and you want to play and you want to go to championships, get vaccinated if you're 16 or older. If you're under 16, we're waiting. There's initial good news about that, but we don't have the formal news to say that 12-year-olds and up can get that, but we're hopeful.
And we're out of time. Thank you so much for being here, Marcia. And again, thanks for what your team is doing. We truly appreciate it. And I guess the message is be diligent, correct? That's what you would tell us.
Yep. Thank you so much, Sarah.
Thank you. Until next week, Spectrum Health-Zeeland Community Hospital wishes you well.